All right. Welcome, everybody. Please select your interpretation channel. We have Spanish, French, and Nepali, and we'll be speaking in English. So I'm just going to introduce myself before we get into our panel. I am Sienna Baskin. I am the coordinator of the Sex Work Donor Collaborative. The Sex Work Donor Collaborative organizes more than 35 funders to improve the quality and amount of funding for sex worker rights. And I'm thrilled to see so many people here with deep concern about sex worker movements in this moment. Before we begin, I just wanted to share a few thank yous. I wanted to thank Erin, Howe, and Ankita Rastogi, who are our researchers who will present today. I wanted to thank Mfura Yachu Diora Gabriela from Uhai Isri, who is supporting us on Zoom, supporting us with the slideshow. I thank all our story contributors and all our allies in fund tracking that really helped us do this research. And thanks to Shane Lucas and the A Great Idea design team who brought this report to life. The report is now live on our website in English, and I shared that link in the chat if you want to pull it up, but I will send it out after the webinar as well. And just want to thank all of you for coming. We have in the audience funders, we have sex workers, and we have allies. And all of you, I know, are very concerned about global funding. And we're going to frame this presentation for all of these audiences. So just a few Zoom notes. This session is being recorded and will be shared on our website. Please use the Q&A function for questions, and I will answer them or I will save them for the Q&A at the end. And you should be able to share comments in the chat, so you can introduce yourself there. Just please be respectful and know that we have a very diverse audience, so be respectful of everyone's experiences. All right, next slide. Can you go to the next slide, Diora? All right, while she's figuring that out, I'm going to start introducing. Here we go. The Sex Work Donor Collaborative. So like I said, we are a collaborative of 35 plus funders, and our goal is to improve the amount and quality of funding for sex worker rights. And we do that in 3 ways. We advocate for more funding through our donor advocacy. We try to become better funders ourselves and our members. And we learn and engage with sex worker-led movements toward our shared mission. So when we heard that the Dutch, the government of the Netherlands, had elected a new conservative leadership that was planning to drastically cut foreign aid, we felt a looming dread because we know how many important sex worker projects the Dutch had funded. And when the US, the United States, brought down a sledgehammer of foreign aid cuts in January of this year, we immediately saw the repercussions among sex worker organizations. We wanted to be able to quantify the scale of these changes to use in our advocacy and planning, and to share that information back to the fields that are affected. But we know that tracking funding for sex workers is very hard to do. So we brought on help, and I want to introduce our researchers. You can go back one slide, Diora. Thank you. Erin Howe of Howe Consulting is a strategy, evaluation, and research expert dedicated to aligning philanthropic resources with what communities need. She has partnered with the Gates Foundation, Ms. Foundation, Open Society Foundations, and others to strengthen effective grant-making practices and data-driven decision-making. She has led all of the Sex Work Donor Collaborative's research projects to date. Dr. Ankita Rastogi is a data and research consultant working with nonprofits and foundations. They use their training in sociology, demography, and biostatistics to help clients access, visualize, and interpret data. Their mission is to use the power of data to fuel movements for gender, racial, and economic justice. So I'm going to turn it over to Erin and Ankit to tell us about this research and what we found. And Erin and Ankit, you can tell Diora what slide you want her to be on.
Hi, everyone. Thanks for joining us this morning to discuss this important topic. Diora, you can go one more slide forward. Perfect. So as Sienna was sharing, in the last year, the Dutch and US governments have announced significant cuts to foreign aid that will impact sex workers. And our goal in this research was to estimate the amount of funding the US and Dutch governments gave that supported sex workers between 2021 and 2025. We'll give figures here for those 4 years, as well as looking at annual averages so that we can tell, we can quantify how much of a reduction we are facing looking at the years going forward. And as we will discuss in detail, funding for sex workers is extremely difficult to track. So the numbers we provide are approximations, and they likely may be undercounts of the money that went to sex worker organizations. So our aim in this project was to approximate the amount of funding in a way that would be time efficient, so that advocates can use the information in real time. Diora, you can go to the next slide. So as many probably know on this call, the funding for sex workers, the landscape, what we know is that 17% of organizations that are sex worker led receive no funding from philanthropic or government sources. These data came from the Global Network of Sex Work Projects, who did a survey. We know that of those that do receive funding is minimal and covers only basic and core costs. And much of the funding that sex worker organizations receive is short-term and project-based. These data are a baseline. Oh, not next slide yet. These data are a baseline, and they don't take into account the funding cuts that we'll discuss today. So sex worker organizations were drastically underfunded even before the cuts in funding that we're going to talk about today. And the funding they receive frequently does not support the priorities that they would identify for their communities. We know that with the funding they receive, sex worker organizations provide HIV prevention, testing, and care. They do anti-violence and rights-based work. They build alliances and develop sex workers' voice and political power, and they do all of that with minimal funding. So Diora, you can go to the next slide now. So I want to just zoom out a little bit and talk about the types of funding that are included in this research. So the data that we'll talk about today are two types of government funding. One is bilateral funding and the other is multilateral funding. And so in case you're not familiar, bilateral funding is financial assistance that's provided from one government or country to benefit another. And multilateral funding is financial assistance that's provided by multiple countries, often through an international organization. So bilateral and multilateral funding that benefits sex workers can be difficult to track, since these types of funding are sub-granted before they reach organizations that are inclusive of sex workers and are led by sex workers. So you'll see there's also a bubble over on the right that is foundation funding. We're not going to talk about foundation funding today, but just to give you a little bit of context, in 2020, the Human Rights Funders Network looked at human rights funding that included sex workers and found $18 million of funding a year. And this number includes some overlap with government funding. As you may know, some government funding is distributed through public foundations or collaborative funds. So the annual average of the US and Dutch government funding withdrawals are almost double this amount. So the government funding that we're going to talk about today far exceeds the amount of foundation funding in the landscape. Yet foundation funding is often very important because it allows sex worker organizations to do rights-based work, to do anti-violence work that may not be funded under projects project-specific funding. So just to give you a little bit of context, and also acknowledging what we won't talk about today, which is that we're also seeing some retraction in foundation funding for sex worker rights organizations, including the withdrawal of that funding from the Open Society Foundations when they changed strategy a few years ago. So you can go to the next slide, Dira. So just to give you a little background on the landscape of funding for sex worker rights. So foreign aid funding is the largest source for sex worker projects and organizations in low and middle income countries. The Trump administration has halted and in some cases withdrawn US funding for HIV/AIDS and public health, which is impacting sex workers, and also the Dutch government plans to cut foreign assistance by 2/3 in 2027. So we know that American and Dutch cuts are only part of the picture. They're occurring in the context of the overall shrinkage of official development assistance, which is projected to plummet by 62 billion annually by 2026, as compared to 2023 levels, due to reductions across 12 donor countries. These data are from Seek Development and are cited in the report. We also know from the Global Fund that they are also facing an 11% cut in their overall funding, which will likely impact projects that benefit sex workers. And Ankita will be talking more about this later. You can go to the next slide, Dira. So I want to give you a little bit of background that could help in understanding and contextualizing the data that Ankita will share with you shortly. So you can go to the next slide, Dira. So, you know, you may be wondering, how do organizations that work with sex workers get any of this funding? Government funding starts out flowing to a re-grantor or an implementer, and then it may flow in a circuitous route from there. It may go to several different organizations before it actually works or reaches organizations that work with sex workers. That's why there's that grayed out line across those arrows, because often the funding that we are looking at that's available in publicly available databases doesn't actually tell us how much of large grants went to sex workers and projects that benefited sex workers. So we've used a combination of different data sources. You can go to the next slide. So I wanted to share with you some of the data sources that we used. We consulted 7 different data sources for this research, which is part of what makes this unique in the landscape, I think, is kind of pulling data together from these different sources. So we used publicly available databases and data sets, such as the OECD, which is looking at foreign aid from country governments, as well as the International Aid Transparency Initiative database, which looks at the funding that the first organization that received government funding is reporting back on, so grantee database. We also use data that are available from other trusted researchers, in particular the Dangerously Off Track report that came from AIDS funds, which has a lot of data about PEPFAR and Global Fund funding. And then we also looked at data directly from organizations that benefited from funding received through strategic partnerships from the Dutch Ministry of Foreign Affairs. So these strategic partnerships were quite important and didn't show up clearly in some of the publicly available databases that we consulted, but we knew that these were an important source of funding for sex worker projects and organizations. So what we did was we got in touch with the coordinators for each of these strategic partnerships and asked them directly how much of the funding that they received went to projects and organizations that benefited sex workers. And they gave us estimations of how much of their funding flowed in that way. You may be familiar with some of these partnerships. Names you might be familiar with are Count Me In, Love Alliance, The Power of Pride. There's 7 strategic partnerships. And so we worked with them to collect the data directly. You can go to the next slide, Dora. So I wanted a couple of notes on the data that I think are important. One is that the data were deduplicated to avoid any double counting. For anyone who's done fund tracking data projects, you know this is one of the big complications because funding may show up in different places. And some of the same funding that got broken down and flowed across multiple organizations may be reported in multiple places. And so it's important not to count those data twice. So what we did is go through and triangulate the sources and make sure to match up any funding that's overlapping so we don't double count. Also, for overlapping data, we prioritize data that came from closer to the ground. So if we heard directly from a coordinator of a strategic partnership about how much of their funding went to sex worker rights, we took that as the data that we would use in the study, replacing the other data sources with data that came from closer to the ground. And then thirdly, if you can go back just one more. Okay. And then also data on funding for sex worker-led organizations were only available from the strategic partnerships because those are not showing up in publicly available databases. So the data that we have on funding for sex worker-led organizations is only from the Dutch government and only through the strategic partnerships. I just wanted to point out that our approach really provided what we feel is the clearest look at the available data and what's at stake for funding that benefits sex workers. And the challenges with data specificity, we feel are political, not being able to look as closely as we'd like about how funding is flowing represents also a lack of prioritization of the importance of funding for sex workers, and investing in exploring what we know we feel is quite important, but also if we could improve those data sources, it would give us an even clearer look in the future. And then overall, this is likely an undercount of government funding that went to benefit sex workers. So with that, I will turn it over to Ankit, who will share with you some of the findings of the numbers.
We can go to the next slide. Thank you, Erin. I'm really excited to present these data to you all, and this is an honor to be here. And so before I jump into the numbers, I just want to say that in the report, we have a lot of stories that provide texture and context to the data and the numbers that I'll provide you. So I really encourage you to dive into the report so you can get that context. Next slide. So starting with the Dutch government funding, we looked at the strategic partnerships that Erin just talked about. And these strategic partnerships are funding from the Dutch government that we know explicitly or implicitly included sex workers. The Netherlands Ministry of Foreign Affairs has funded strategic partnerships to strengthen civil society since 2016. And this approach fell under its dialogue and dissent policy framework. And by 2020 had supported over 7,000 organizations and resulted in almost 1,500 improved laws, policies, and social norms in over 65 countries. So our analysis here covers the years of 2021 to 2025, and then again includes many of those organizations that Erin talked about that you may be familiar with, such as Hands Off, Love Alliance, and Count Me In. And so from these strategic partnerships, we found that 22.4 million euros went to sex worker projects, and about 13 million of those went to sex worker focused projects and organizations, while 9.5 went to sex worker led. And then when we look at Dutch funding altogether, that was resulted in about 6.5 million euro per year. And Dutch funding is especially important, has been especially important, because it's not just HIV focused. It covers a broader range of what sex worker movements need, including organizational development support, funding for anti-violence and decriminalization work, as well as rights promotion initiatives. The other funding sources that we'll talk about a little bit later are primarily just HIV-related work. So I just wanted to uplift here that the Dutch government funding is broader than HIV funding work. And so One example of the strategic partnerships is the Count Me In Consortium. And the consortium started with support from the Dutch Ministry of Foreign Affairs in 2016. And the funding went to Mama Cash, Red Umbrella Fund, Urgent Action Funds, and other feminist international women's rights organizations. The Red Umbrella Fund reported moving over 2 million euros to more than 80 sex worker-led organizations in the form of core flexible grants. The funding also supported Red Umbrella Fund's core operations, including their sex worker-led grant-making committee and strategic board, as well as the sex worker-led secretariat. So given all of that, the loss of direct grant making, as well as their global advocacy, will be felt far beyond the individual organizations in African, Asian, and Latin American countries that were included in the Count Me In designated countries. Next slide. So now moving on to US government funding. There may have been other sources of funding from the US government, but PEPFAR was the main documented source, which is the President's Emergency Plan for AIDS Relief. And here we see that through PEPFAR, $77.7 million went to sex worker orgs and projects from 2021 to 2023, resulting in about $26 million per year. So that's pretty huge. And before this funding, before PEPFAR funding, sex workers were not adequately reached with prevention and treatment services. PEPFAR engaged sex workers as service providers, bridges to cares and peers, and making sure they're well connected to their health care services. Next slide. And our last piece here is multilateral funding. And multilateral funding is larger than bilateral funding. And the Global Fund is the largest multilateral effort that benefits sex workers. And we see that here pretty clearly, where $182 million, about 173 million euros, benefited sex workers through the Global Fund between 2021 and 2024. And that's results in an annual average of $45.5 million or 43 million euros. And I think it's important to note that these numbers only include funding for prevention, not treatment, as the Global Fund never disaggregates treatment data by population due to concerns about privacy and confidentiality. So as a result, these numbers are definitely an underestimate. And we are concerned about the Global Fund because their funding is made up of contributions from country governments. And in the context of shrinking funding for foreign aid, the Global Fund may also be impacted. And this bar chart on the right shows that the US government gave about a third of the Global Fund's budget between 2021 and 2023, and that shrank to 29.6% in 2024. Also of note is that the Global Fund is a pooled fund across countries, so contributions cannot be earmarked. And we know that the Global Fund was reduced already by 11% overall through a reprioritization process. The extent to how much this impacts HIV prevention programs for sex workers is still unclear. And moving forward, any reductions in funding commitments for the next grant cycle, including from the US and Dutch governments, will likely impact its ability to continue funding HIV prevention programs for sex workers at the same level. Next slide. And so one example of this work is Cambodian Women for Peace and Development. Antiretroviral coverage among sex workers living with HIV is almost 83% in Cambodia. And in the mid-1990s, HIV infections soared among Cambodia's sex workers with prevalence close to 40%. And with Global Fund support and its partnership with government and civil society, that has now fallen to 4.9%. So this is an example of the ways that the impact of Global Fund is staggering and the funding that is coming from the Global Fund. Next slide. So taken together, what's at stake overall? To put it all together, it's an annual average of $33 million, roughly 30 million euros of bilateral funding from like the US and Dutch governments. And then again, a reduction of the annual average from the Global Fund of about $45.5 million or 43 million euros. And yeah, here we're only talking about the numbers, but these numbers don't truly capture the overall breadth and depth of what sex workers have achieved with these resources. Again, underscoring the importance of this funding. Thank you. Next slide. Yeah, so that's my piece, and I'm excited to pass it over to Pitty Peter.
Thank you so much, Erin and Ankit. Thank you again for your hard work on pulling this information together. So I'm very excited to welcome Pitty Peter to give us perspective on this situation. Pitty Peter is the coordinator of the Namibian Sex Workers Alliance, a national movement comprising 8 grassroots sex worker-led organizations across Namibia. A transgender sex worker and seasoned advocate, Pitty brings 12 years of experience in HIV programming, community mobilization, and rights-based advocacy. Her leadership centers on amplifying marginalized voices, advancing health equity, and building solidarity across movements. So welcome, Pitty. Pitty, I wanted to start by asking you if you could tell us more about the Alliance and what PEPFAR funding has helped sex workers achieve in Namibia.
Yes, Tina, thank you so much, and welcome everybody. Thank you. I think I'm. Can you guys hear me?
Yes, we can hear you pretty
Can I
well.
be? Oh, okay. I'll continue. The Namibian Sex Workers Alliance consists of 8 sex workers grassroots organizations. It's a movement that was formed in Namibia, and the alliance um, is the umbrella body of the sex workers-led organizations in Namibia. Briefly, to speak about how the PEPFAR funding has been helpful to Namibia. I would start by saying the U.S. funding not only helped community-led interventions such as peer-to-peer linkages, but through this funding, sex workers were trained as community health workers. Where they provided information and information on prevention and the importance of treatment uptake to their peers, and also did condom demonstration and information on PrEP and STIs. The sex workers were often trained as rapid testers with this funding, and they went on outreach activities and provided HIV testing and counseling in rural areas, which are especially really hard to reach, especially with HIV programming, as some of the geographical areas were not really covered by the HIV programming in Namibia, and we only had certain areas that were covered. So this program, the PEPFAR funding, really helped us to escalate and up until rural areas to reach the hard to reach communities also. And through this training, sex workers were also trained as case workers and community counselors. And the caseworkers have been giving support to the sex workers that were enrolled into case management through their journey to ensure positive are retained on treatment and are virally suppressed, and that negative remain on prevention. And that was what this program enabled us to do with our community as sex workers and sex workers leadership. I would also say that sex workers were trained as case managers, often also provided psychosocial support through peer interventions. They have been also providing ongoing support in retaining sex workers on ART and PrEP, monitored their viral load suppression, and also scheduled them for follow-ups and reminded sex workers whenever they were booked for their next follow-ups. So this was a journey that the case managers has worked with the sex workers through this project that were trained as case managers. And also if there were any other clinical needs or specific needs for sex workers that were enrolled into case management, the case managers took it upon themselves to escort clients for these specific needs whenever a client would really just call you anytime, because they have been provided with contact numbers of caseworkers, and caseworkers had that that communication, ongoing communication with clients, just to ensure that the clients are fine, that has been enrolled into case management. And also with the trust built amongst the case managers, which are actually also sex workers. It was really easy for sex workers to access government institution, because at first it was really hard because of the stigma and discrimination that the sex workers really did not want to access services that was provided at the government institutions. But with the case management component that came in with this project, it was really easy that they built this relationship with the ministry also, and the sex workers themselves, the movement themselves, and the sex workers movement itself. And it was really easy for sex workers to seek for services through case managers in case they needed any other professional expertise or interventions, such as releasing social workers for further interventions. The PEPFAR funding also through the KB Star project ensured that healthcare professionals, social workers, and law enforcement was thoroughly sensitized through the program on key populations and the issues that key populations are facing. And I was also part and parcel of this sensitization process with other leaderships and few brave sex workers that shared the same space with law enforcement and healthcare providers and social workers when we did the sensitization, just to speak about their issues and the challenges they faced within the industry. So this really also break the wall in terms of the stigma that went around and the discrimination that went around within the institutions themselves. I would also say that the funding also assisted organizations with their operational costs, such as office rent, which provided safe havens for sex workers, where they knew they could just come anytime for help, or also report human rights violations whenever it occurred. In their lives. They would just walk into the space and then just address these issues or bring it up to the attention of the organizational leadership, and the organizational leadership would take it up with the relevant authorities or the relevant institutions, and we would come up with amicable solutions because of the relationship that we have built through our stakeholders and our allies through the PEPFAR funding. I would also say, sadly, with the withdrawal of the funding, many organizations were forced to close their doors, and some of them are unable to really afford rent or sustain outreach activities that has been ongoing. And this has actually driven us back from the gains that we had and the efforts that we have put in as a country in the past 10 to 13 years. I would also say this has also left a devastating gap in service delivery for our community, and the support that the community has been getting from the grassroots organizations themselves. And it also worries me that after all the efforts and the hard work fighting towards the 1990 targets as Namibia, which I believe Namibia has achieved so far, and it has been working towards the 1995 targets. We, as the Namibian Sex Workers Movement, is faced with a major challenge where our hard work and end gains are being threatened right now because of this PEPFAR aid cut, and we are worried that our sex workers and peers might also, for especially those that were initiated on treatment during the period before the aid cut and the stop work order, might also default, and this will take us back from what we have achieved so far as a movement and as organizations. Yeah, I think that's it.
Thank you so much, Piti. It's really incredible, to hear about what was possible with this kind of funding, which I know was never enough for the amount of work that you, the Alliance, and all of your member organizations were doing but it did enable this incredible infrastructure of support to be built. I wanted to hear if you have an estimate of how many people have just lost their jobs after the PEPFAR pause. Just a guess, I'm sure it's hard to count, but from all the outreach workers, all the sex workers who are working to support their communities, do you know how much that kind of loss has looked like? Can you hear me, Pitti? Oh.
If I have to estimate, I will say that we had about 36 organizations were working on the ground. Yes, I can hear you. Can you hear me?
Okay, yeah,
Can
you
you
were
hear me?
breaking up a little, but now you're good. Can you
Hear
repeat what
me?
you?
Can you hear me?
Yes.
Okay, if I left to estimate, I would say it's more than 50 it's more than 50 people that have lost their job. Because I would start from saying that more than it's more various countries would have more than 10, or you'd have more 12 peer educators, and you only have about 5 to 6 managers in a town, or 4 case managers. But overall, if you'll be covering more than 6 towns or 5 towns, you would have an estimated number of 40 on your own as employees that have been working on this project. So it's more than 80 people that have lost their jobs.
Thank you. Thank you for estimating that off the top of your head. I think it helps give a sense of the scale in one country of the impact on sex worker health services, let alone advocacy, organizing, other kinds of support. I wanted to hear from you, Pitti, if you could share a little bit about how you and your members are responding. What ideas you have about how to sustain the movement in the face of these devastating funding losses.
I would say that we are not giving up as a movement. Our leadership is mobilizing with agency and creativity. Um, we are busy strategizing as a movement on launching advocacy campaigns, and also highlighting the impact of these cuts with our regional partners. And we believe we would have a platform where we can engage donors on the important role that this funding has been playing in the country itself overall, not just in our movement specifically, but also in other movements that has been funded, or other organizations that has been funded, that has been doing the same work that we are doing, that we have been doing for our community. And we continue to support each other through solidarity actions, storytelling, and regional coordination. Even with the limited resources, our commitment to health and dignity and justice remains unwavering. And we are currently also engaging with our regional partners, and also just looking at what they are doing currently with the same challenge that we are faced with, or how they are what strategies they've put in place, so we can also employ that strategies probably as a country and as a movement in this country. But nevertheless, also I would also say that our leadership in the country, and the organizational leaderships that we have, has been working so hard without resources. Um, and I would say offices are also based at home right now, but sex workers continue to access or would specifically call do house calls with our leaderships, and so with some of the managers, although they are also faced with a huge challenge because they've lost their jobs, they continue to support the sex workers that were enrolled into their care, and we remain resilient, and we remain focused on what we have been doing, and we believe we will overcome the storm someday. That's what we really believe, and we are not giving up. We are not really giving up as a movement. We are continuing to support, and we are continuing to support each other through our solidarity actions.
Thank you so much, Piti. And that echoes what I've heard across the world, really, that there's this incredible resilience and dedication to continuing towards all of the goals of the sex worker rights movement, even faced with these devastating losses. I wanted to open now to questions. Please put your questions in the Q&A, or if you have trouble with that, you can put them in the chat. I'll try to find them. We have incredible people here from all over the world, funders and sex workers and allies. So I'd love to hear your questions for Piti, for our researchers, Erin and Ankit, or for the Sex Work Donor Collaborative. There was one question that looks like, Erin, you answered, but do you want to speak to that a little bit as well, just for everyone's benefit?
Yeah. So the question was about the proportion of funding that was confirmed from the strategic partnerships and came from partners on the ground. And so I hope that I've answered this correctly, but I think what you are asking, we found that 22.4 million euro went to projects or organizations that benefited sex workers between 2021 and 2025. That was the most recent tranche of funding that came through the strategic partnerships from the Dutch Ministry of Foreign Affairs. And these data came directly from the coordinators of all 7 strategic partnerships. They all responded to us and were committed to providing us with these data. And some were down to the dollar they had been tracking, and others provided an estimate. But we feel like these are this is the best and clearest picture that we can provide, given that those came directly from the coordinators of the strategic partnerships. So that's where those data came from.
And the coordinators were generally many Dutch-based NGOs, INGOs that were distributing this funding to organizations and partners. We did have another question about the impact specifically on trans sex workers. And I don't know if that is, I bet Piti could speak to that, but we could also speak to that in terms of the data. Piti, but do you want to start and reflect on how you've seen trans sex workers affected in particular, if it jumps out to you?
Yes, I would speak as a trans sex worker myself. When I was giving my presentation, I really did not categorize or really put it out to say that on the different categories of sex workers that we are working with, but I mean the diverse sex workers that we are working with. But I would say that the impact on us as trans sex workers is really high because as 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 a trans sex worker myself, it was really hard to also have trans sex workers enrolled into this project because at some point with some of the documentation they felt violated, and it was really hard for us to really, and we had to re-look over some of the documents with the primary recipients of the funding, and we had to also engage with some of the trans leadership within the country to flag on how what they feel should have been put in terms of how it needs to speak for trans specific community. So at that stage, I would say it is really difficult for trans sex workers because of our sexual orientation and gender identity, and we are faced with a holistic challenge that we as the leadership and of the movement and as sex workers leadership and organization are losing. There's all
Oh, PT, you're breaking up a little bit right after you said sex worker leadership. Right, hopefully PT will come back and finish that comment. Oh, can you try again?
with a project because
You're breaking up.
now
You're breaking up a little too much, Piti. I would love to hear Erin and Ankit,
we have
if you have any thoughts. Oh,
we have
Erin and
a
Ankit,
challenge
do you
of
want to speak to the data piece on how tricky it is actually to narrow in on what sex workers who are affected and all their intersectional identities and how those things might interact?
Yeah, thanks for that question, Barbara. I think it's a really important one, and I will say that intersectional funding data, so funding, looking at data that for funding that benefits multiple intersecting identities, are often really hard to see in government sources. There's not an incentive. Normally, how it shows up is like a laundry list of populations, but we can't tell how much of that funding actually went to people who were both trans and who were doing sex work. And so it's very difficult to tell in that way. But I will say over the 10 years that I've been doing this work, I see more and more when flexible funding is provided on the ground, organizations are working on the ground with folks with intersecting identities and being more and more inclusive of trans folk in work that they're doing with and for sex workers. So I am optimistic about when flexible funding is provided to sex worker-led organizations that they are including and that the work is also benefiting trans sex workers, but it doesn't show up as clearly in the data. And that would be an area that we could explore further in the future. Thank you.
Yes, thank you. Yeah, what always strikes us when we do this kind of research is how the way data gets tracked is often so political. The fact that we can ask the Dutch government, how much sex worker funding did you distribute? And they don't know. They didn't track it, even though, they funded quite a bit. And it's because, and they funded it, outwardly and publicly, but who really cares about these populations and enough to track and measure the impact is, often us and sex workers and allies. So we have to carry this work. I wanted to get to two more questions. One is from Chibundo, which is, I had a question I submitted when registering, repeating it here. Black trans sex workers in the southern states of the US have historically faced a double bind in sex worker funding, being in the global north, but also being abject and empire. This funding change has significantly affected their ability to work and live. Does the report have paths forward for marginalized sex workers in the global north? Thank you for doing this. Erin, I think you're typing right now. I would say the focus of the funding that we're talking about is the global south. Most of the funding that is foreign aid funding, it goes from global north governments towards global south governments and NGOs. Which doesn't mean there is not funding for sex worker rights in the global north. There is, and some of it does come from government, from global north governments even. But it's different from what this report was focused on in terms of these specific funding sources and where it went. I will say, being from the global north myself, that I couldn't agree more that sex workers in the global north who are of global majority racial identities or are in oppressed identities, racialized identities, do face a double bind because funders often see, oh, these are rich countries, they don't need as much of our support. And yet, when you are in that situation in a rich country, you can be even more excluded and marginalized. So the funding is needed in the global north for this kind of work as well, and it is often overlooked. And would be a great topic for a future report. But Erin, did you want to speak to that at all? Oh, you answered in the chat as well.
Yeah, I was just going to say Global Action for Trans Equality and the Global Philanthropy Project, along with me and some colleagues, did some work to survey trans-led organizations globally that has some of these data that are broken out by region in the U.S. And I know that there are advocates that are using those data in their work to try to get more resourcing. And if you haven't seen it, we can send you the link. And I also think that the folks who did that would be a good place to reach out, to get in touch with the efforts that folks are doing in the US to mobilize more resources for Black trans-led organizations in the South.
Yes, it's being tracked and being used in advocacy. The last question here in the Q&A is from Sean Martinez from Open Briefing. I just learned about your organization, Sean, when you emailed to me. I was wondering how the forced reduction in services has an impact on the physical security of sex workers and whether digital services that aim to prevent harm to sex workers had also been impacted. I'm sure the answer is yes, because so many of these organizations, as Pity shared, may have been doing HIV prevention and treatment, may have been funded to do that, but we're really doing so much more, including responding to violence as sex workers were being affected by that violence. Pity, do you want to try to come in and speak to that question? I know that your internet was a little spotty. I will say one more thing to you, Sean, which is that we recently at the Sex Work Donor Collaborative had a digital security training with an expert on sex workers' digital security. And there was enormous interest from the community of sex worker organizations that we outreach to in shoring up digital security, understanding how to protect yourself in the digital space as well as in the physical real world. So there is a real need for that kind of capacity building and sharing. And there's also a lot of expertise that sex workers have in digital security and digital literacy, because sex workers are early adapters, early adopters of technology, innovators in technology. And it's, becomes such a huge part of how sex workers work in many parts of the world. So there's a lot of synergy there, I think. Just going to quickly see in the chat, looks like lots of things are being shared, which is wonderful. So I'm going to just wrap us up. Thank you all so much for coming. Pity's story is one of so many that are unfolding around the world, affecting millions of people. We're really in danger right now of losing ground, and it's really an existential moment for the sex worker rights movement. And at the same time, we are so inspired. I always like to say the sex worker rights movement is poor in money and dollars, but rich in people. There are always leaders coming forward and taking on these challenges, which always gives me hope. To wrap us up, I want to just share a few notes on the current state of play for these funding sources. It's a rapidly developing situation. So what really this report is just a snapshot of where we are at this moment in time. As for the Dutch, the funding is intended to be cut by 2/3, but new instruments are rolling out on HIV, on gender-based violence, on women's entrepreneurship. We really need to make sure sex workers are funded in these instruments, even if they're more limited and more focused on limited regions. For PEPFAR, PEPFAR may continue. It will be in probably a very severely limited way. It's already been restricted to life-saving clinical services and pregnant women, but we need to support any remaining allies within that agency to use these funds for good, and we need to have regime change in the United States. For the Global Fund, the focus is really on the eighth replenishment and supporting the Global Fund in general so that it can fund what's most important for ending HIV, which is many things, including sex worker rights. And I just want to say that the time for advocacy is now. This is a global crisis in so many ways we're living through. The amount of people doing sex work is only going to increase while their circumstances become harder. We're lucky that sex workers continually come forward as leaders and fighters. We are grateful that HIV funding has helped to build this movement. We also know that we need new funding structures. We need new kinds of funding that really support the priorities of the movement, including HIV, but so much more than that. So for the funders in the room, fund sex workers. Reach out to us if you need more information. I'm going to share, and for the sex workers in the room, we would love to hear from you. We would love to work with you in some way. I'm going to share 2 ways to join us in the chat. There is a listserv for sex workers and allies. There is a listserv for funders. And you can also join us, become a member. And I'm also going to trigger a little audience poll. Please fill out this poll. Let us know what you got out of this webinar. Please check out our report and stay in touch. We would love to hear from you. Thank you, everyone, for coming. All right, I did put the poll up, and when we log you out, you will also get it as a survey. So please do fill that out and stay in touch. Thank you. Goodbye, everyone.